Clinical practice groups are clinical pathways associated specialties, which we've worked with there's 4 key areas. There's women's and children's services, there's medical and urgent care, surgical and associated services, and we've also got transplant and specialist services. So there's multiple pathways that work across all of those areas.
The CPGs oversee pathway teams, and those pathway teams redesign care for specific clinical conditions, if you like, pneumonia, total hip replacement, total knee replacement, and the CPG architecture oversees those. They're permanent because they look at the outcomes that are derived from the redesign of the pathways, and they replace a way of looking at clinical outcomes on a regular basis. They redesign the pathways that we've looked at, and they also agree a standardised evidence base for the sort of clinical changes that we're going to make.
Got multi-professional teams from all clinical specialties working on pathways, so that's very exciting. We've had over 400 clinicians involved throughout the last 18 months.
The principles behind that are to standardise where possible, always to change it depending on the patient's need, and to simplify. And this is one of our most successful pathways, which is the keeping women and babies together. It's effectively trying to reduce admissions to neonatal care after 34 weeks.
And that's gone nationally as well. So NHSI have taken on the work that's been done. They've published articles, and we've reduced the term admissions of term babies into the neonatal unit from about 13% to 6%, which has been maintained.
We're only part way along implementing some of the work we've done, but we think it's useful to share, and hopefully it will trigger some thoughts in you as you approach what you're trying to do in your own systems. We did that when we formed a partnership with Intermountain Healthcare, which many of you will know is a high-performing system within the US system, and this is the main reason we chose it. It's in the top right-hand corner of most cost-effective and most healthy population. And Intermountain runs a healthcare system of 22 to 23 hospitals across the whole of the Utah, southern Idaho region. And they have a 30-year history of reducing unwarranted clinical variation, and that's probably the thing they're most known for.
John Connolly went over to Intermountain and came back and said, well, we can do this. He was really inspired by how they were reducing unwarranted variation using improvement methodology that I've used at the Royal Free for a good 10 years before we've gone for CPG. So what was really great about this was that we saw a methodology in action. They'd saved an awful lot of money, they'd been at it for 30 years, and we thought, well, can we do this? And it felt like the organisation was looking for something that was going to engage the group of hospitals in the Royal Free group.
Most of our clinicians seem to believe it's the way forward. Most of them are willing to take the time to try and do it, and that's a long way into achieving something at least. Thank you.